This is the UC Davis Health Informatics Minute. I am Professor Sean Peisert. When health records were only on paper, security was easy. You put files in a safe, you locked the safe, you gave one person the key, and you installed water sprinklers to protect against fire. Now we have health records and scientific medical data generated, stored, and accessible by any internet-accessible system, such as laptops, iPhones, and iPads. Physicians dictate records and send audio files to India for transcription. Robotic, surgical, and sensor devices are used in operating rooms and are connected to hospital networks. We say that we have records, data, and devices on secure systems with virus scanners and behind firewalls and intrusion detection systems, but are they really secure? What does that even mean? Designers of computer systems treat security as binary, black or white. Access is granted or it is not. Someone is inside a building or not. Further, the assumption is made that access to data and systems are precisely correct. Someone has exactly the access they need. But this outlook and these assumptions are rarely an accurate depiction of reality on computer systems. Ubiquitous smartphones and tablet computers move in and out of supposedly secure facilities. Wireless networks permeate walls. Designers of computer systems also erroneously treat security as purely a technological problem. But it is also social. For example, consider how people's roles, jobs, and needs change and vary, sometimes even within a single person. A physician may also be a hospital administrator, medical researcher, teacher, and possibly even a patient at the same facility. What access should that person have at any particular moment? A computer can treat all of these things differently, but how can we expect a person to compartmentalize each role within their own brain? The consequence of the failure of security to move past purely binary and technological solutions is that health records and scientific data are at risk of being lost, altered, and leaked. Medical devices are at risk of being tampered with or even simply made inaccessible at a critical moment in a way that puts patient safety at risk. Simply put, the designers of computer systems and software have failed to produce solutions for which there is uncertainty about people, risk, trust, and levels of access and knowledge. Our use of computer systems has changed in a way that existing static, perimeter-based solutions cannot cope with, and a completely new mode of thinking is needed. One that recognizes that systems, devices, and data are dynamic, mobile, and ubiquitous, and thus security solutions must also be dynamic, flexible, usable, and ubiquitous. One that recognizes that people are part of the security equation, and so personal, procedural, psychological, and sociological elements must also be included in the security equation. Our research is focused on exactly this reality. This is the UC Davis Health Informatics Minute. I am Professor Sean Peisert.